Assalamu alaikum wa rahmatullahi wa barakatuhu. My name is Shakil, Salam, and you're watching Ummah channel. And this is the special program for month of Ramadan. It's called Healthy Bites. It's a Ramadan special. What we do is we talk to health-related issues during month of Ramadan. We got specialist health professionals to come and join me. I'm really happy that today we have Dr. Abdul Mannan, who is a GP in Rosendale. Assalamu alaikum, doctor.
Wa alaikum salam.
How are you?
Alhamdulillah, I'm fine. How are you?
How's the Ramadan going along so far?
Very good, yeah, alhamdulillah. Alhamdulillah,
So
very
far
good.
so good.
Yeah, not a problem.
Jazakallah for coming along and talking to us.
No problem.
Today is your favorite thing, you know, because you probably come across every day in your practice. This is the common question people ask during month of Ramadan to a GP. So let's kick start with one of the most common question people ask to a GP, and our list, this is the top question, is injection. In month of Ramadan, is it okay and safe to have injection? Medical point of view, what would you say?
Well, as you know, injections, generally, people are on it for important conditions. They may be on it for insulin reasons. They may be on it for, mental health problems. So they may be on it for cancer. So I can think of many examples. One common factor is they are all important. They're not optional. There are a few optional cases, for example, having a vitamin B12 injection, for example, which can be changed or whatever. But it doesn't change the fact that, I certainly am of the view that it's not something that's going to affect, giving the injection itself in terms of affecting the fast. However, the question arises is, should that person be fasting in the first place? Quite often I find that person probably shouldn't be. They're on that medication because they're not well. They're quite unwell. So that's probably the answer to that question.
Can I just say here that people need to probably seek their advice from their local Imam, because in terms of religious thing, they need to probably get proper advice.
Absolutely.
But what we're talking here is a medical point of view.
Yeah, it's a medical point of view, and don't forget, it's a generalized viewpoint.
Absolutely.
Yeah? So, like I said, I'm assuming most of these situations, the patient is unwell, right? So when somebody is using insulin as a diabetic, generally they've got advanced diabetes, they've got type 1 diabetes, and they can get quite unwell if they fast. But that's not 100% of the time. Some people can. People who are on injections for mental health problems, for example, generally speaking, they're struggling because of their condition. Are they going to be able to fast?
Yeah.
So as you rightly say, Shakil, I think it's best if people, get an opinion from their Imam or somebody there, go for Islamic guidance, and also couple that with the doctor's advice.
Okay. I know you mentioned about for diabetes that it can be rearranged, the medication, so people can take something for iftari and something for sahri.
Yeah.
Can people with insulin, can that be adjusted for people with diabetes who are taking insulin? Can that be adjusted on certain time, or it have to be on a couple of times a day, or it have to be on certain time?
In short, yes, it can. I have got a few patients on my panel, on my GP list, who I adjust their insulin regime in Ramadan, and I tell them how much to consume, how much to take during iftar time, and how much to take at sahri time. I tell them what doses not to take, for example, in the daytime, because they're not eating. And I am able to adjust it to so that they are able to then fast. I also put a word of caution there, because it's risky. Don't do it yourself. Make sure your doctor's involved, and make sure he or she is happy to say to you, okay, go ahead and fast, because there are many diabetic people who are on insulin who will also struggle to fast, and who may even put themselves at risk by fasting. So it's very, very individual.
Okay. Okay, moving on to the next question, which
Yeah.
is very commonly asked by most of the GPs,
Mhm.
is people who had asthma
Yes.
and they have certain medication, but at the same
Yeah.
time a pump as well.
Yes.
Does that break the fast? You know, how far does
Sure.
it go to affect your digestive
Okay.
system?
Okay. Okay. Now, I think again I have to put the disclaimer in there. I am not a scholar. You know, I'm a Muslim. I have a certain amount of knowledge, and as a doctor, I do probably look at the Islamic viewpoint on health matters a bit more than perhaps other issues, because that's my interest. Now, I'm of the view that the inhalers that you take for asthma, there's no food in there. There's nothing nutritious in there.
Okay.
It's gas that you're inhaling, and that's important to note as well. If you use the pumps, the vast majority of that gas is going into your lungs, where it's supposed to go, and it's non-nutritional. So I personally think it's fine for people who have asthma to be fast, to fast, but at the same time take their inhaler. But I have to tell you that I have come across variations of opinion. There are certain scholars who may have a different viewpoint to that view. So please, I would say to the viewers, discuss with your local scholar and make sure he or she, you see what their viewpoints are.
Okay. Moving on, the next
Yeah.
question is, as we talked in some of the program, and we're going to carry on talking about one of the important issues, which is smoking.
Oh, yeah.
And people who don't smoke for 17, 18 hours during the month of Ramadan.
Yeah.
And they probably find it very difficult. I mean, technically, they should give up smoking, and that's probably advice come from you.
Yeah.
But there are some products available to support you to give up smoking, or there are some medication, especially patches. And some people prefer to have patches during the day in the month of Ramadan.
Yeah.
What do you think of the patches? Do you think that's...
The patches in general, we find that patches are permissible whilst you are fasting. In terms of the patches for reducing your craving, I have to admit, I'm not 100%. There is viewpoint on either side, because the argument is, what is it that you're replacing from the patch? Yeah? It's nicotine.
Okay.
And can that be something that you should be having while you're fasting, regardless of whether it's coming through a patch or whether you're inhaling? So I'm kind of yet to be convinced about that. Personally, in Ramadan, you should stay away from smoking. And as things stand, I am of the view that patches I'm not very keen, from an Islamic point of view.
Yeah.
That's different to the viewpoint I have, for example, for my patients who have angina and they're on patches. That's different from people who are suffering from chronic pain and they have to go on patches. With those patients, I'm personally, from what I have, what I understand to be in those patches, from the Islamic viewpoint that scholars give us, I'm personally happy to recommend that they can continue with their patches.
Okay, so we talked about injection.
Yeah.
We talked about patches.
Yeah.
We talk about inhalers.
Yes.
Another thing people always ask about is, in month of Ramadan, people might be prescribed because of their eyesight. They might be using some drops.
Of course.
What impact these drops have, and do you think, medical point of view, it's actually absorbed in your body and it can break your fast?
Again, if you look at what's in eye drop, usually there's a chemical there that's going to be treating an infection, or it's going to be treating your eye pressure, or it's going to be treating a viral infection in your eye. So that's generally what's in there. There's also anti-inflammatory eye drops, so which are all non-nutritious. The actual fluid the drops come in, it's a non-nutritional fluid, and it's going into your eye. So it's negligible, really, what's going to go into your bloodstream and so-called hydrate you. You know, so no, the opinions are quite clear out there. In general, we see that you're okay to use eye drops, and for that matter, ear drops as well. Some people use nose drops as well. So in general, with drops, I don't see an issue while you're fasting.
So when you're putting eardrop or nose nasal spray or something, that doesn't actually. What impact does it have? You know, the eye drop. Does it stay?
Well, you see, there's an active ingredient there, which is to treat whatever condition you're dealing with. So in the example of eyes, you're either dealing with bacterial eye infection, viral eye infection, you may be dealing with inflammation, you may want to reduce the eye pressure because people have a condition called glaucoma. So it's those type of conditions you're dealing with, you know, and the ingredients are not going to help the patient in any way from a nutrition point of view or hydration point of view. So therefore we use the, eye drops, ear drops without any hesitation.
Okay, just moving on, and this is another question. You know, there's always question in terms of the women who are pregnant. In pregnancy, well, in my opinion, they shouldn't be fasting.
Sure.
If they chose to fast, how much impact it will have on their own health and the health of the child?
I think that's a good question. I'm glad you asked that, because I do come across a situation where ladies who are pregnant, they're almost asking me that they have to fast. They feel compelled to. And it's lovely to see that, the zeal and the jazba, the kind of motivation to fast. It's so high, and you love seeing that. But I do remind my patients that, you're carrying a child. Your duty and your responsibility is both to look after yourself and this unborn child. And you mustn't do anything to jeopardize both yourself and the health of that child. And there is good evidence, especially in early pregnancy, where it can affect the mother and, very importantly, the child. I strongly try to discourage my patients not to fast during pregnancy. I also remind friends and patients that, look, there is clear dispensation about the permissibility of not to fast whilst you're pregnant. And it's there for a good reason. Islam is about making it easy for us. It's not about making it hard for yourself. And take advantage of those rules.
Yeah, and as I said, I must remind that we're talking about the medical point of view. In terms of religious advice, please seek your local imams, and they will give you sort of religious point of view. Of course. This is medical terminology.
Absolutely.
And because I'm moving on to the next issue, children. A lot of children love to fast. It's excitement. It's something they want to do.
Yeah.
But to be honest, there is a limitation as well, isn't it? Depending on your age and depending on the length of the Ramadan as well, especially in summer now. It's a very long fasting timing.
Yeah.
Some of the young children, they wanted to do that. They probably forced their parents to get them up in the morning. Yeah. And they want to be, going to school and carry on with normal duties. Yeah. What impact it have on a young child? Because we're talking about very young, because there is specific guideline in terms of Islamic point of view.
Of course. And if you was to explain that guideline, it's, we know that in Islam, it's quite clear that it's when a child achieves that maturity that he or she should begin to fast. And there's issue, you can say, is it puberty? Is it the mental maturity? So a child might be 10 years, 11 years, when they've achieved that maturity. And we can talk about the definitions of that another time, perhaps.
Yeah.
But generally speaking, until that time arrives, that child, it's not a fard, it's not obligatory for he or she to fast. I fully understand the pressures. I'm a father. Before I'm a doctor, I'm also a father, and I have young children. And it's beautiful to see their enthusiasm. They want to have iftar with us. They want to wake up in the night and have sehri. They love that middle of the night meal, and it's good. And we should not be killing off this enthusiasm in young children. But I think there's a way to go around it. In that, you've got, we used to do half fasts, for example.
Yes.
Mum used to make us do half fasts as children.
That's a training, isn't it?
Yeah. We used to do weekend fasts.
Yes.
But bearing in mind, when I was at school, the fasts were shorter. You see, I vividly remember there was sometime in the month of like, I think it was more like January, February time.
Okay, all right.
So it was a
They
lot
were very short,
shorter. So it was easier for us to do that. And we have to bear in mind that the fasts at the moment, they're in the summer season. It's a lot warmer. The days are much longer. And it's going to be difficult. And when it's not obligatory for young children, then should they fast during the week? In general, I try and advise my patients, my parents who ask me, say, look, it's be easy. Whilst the child might be very enthusiastic about it, try and work out a Ramadan plan with them, so that it's practical and it's not affecting them physically, mentally, and so forth. And very important is to remember is a negative experience a child may have as a result of, especially if they force themselves or if they feel that way, and they're forcing themselves to fast. And because let's be honest, it's not always easy. Not everybody finds it easy, and children are no different.
Okay. Moving on, there are issues, and as I said, Islam is a complete guide and it's very clear guidelines. From a medical point of view, I would like to ask you the question, because what happens is the people feel that they have to do it, they have to fast, and they have to encourage their families and friends.
Yes.
Now, we mentioned about mental health issues where people have mental health condition and they have to be treated, they have got medication, they have to give an injection.
Yes.
Moving on to people with learning disability, and they seem quite reasonable. They might not be on any medication.
Yeah.
And I think that's why perhaps parents feel that it's really important, because they're grown up.
Yeah.
They should be fasting.
Sure.
What's your take on that?
Okay. Again, remember, we know earlier on we said when children achieve the age of maturity, I think there's an important point there. If the person with, say, learning disabilities doesn't achieve a maturity, even at the age of 15, 20, 30, and there are, then you have to really carefully consider whether he or she is able to fast. He or she, do they have to fast even? Because they don't have that capacity to think, to make a conscious decision about fasting. So it's questionable whether he or she should fast at all. And correct me if I'm wrong, I think there is clear guidance on that.
There are.
About people who are not sane, who are not able to think for themselves, who are so ill they can't think for themselves. So for me, Islam has given the answer there. If somebody can't make those decisions, then I personally don't think it's obligatory for them. If somebody has certain amount of learning disability, for example, some people have Asperger's syndrome, some people have autism, for example, and I've got patients who have autism, but actually they can hold a job down.
So that's,
Yeah. So whilst that person has, well, one of my patients, he's a lawyer. He's a lawyer, However, he does have a mild form of autism. He's had that since being a child. So there are conditions which will fall under the category of learning disabilities, which doesn't make a person unable to make their decisions. For all you know, they're perfectly capable of people and they can fast.
Okay, final question, sports, especially swimming.
Yeah.
In month of Ramadan?
In general, as I've said before, in that in Ramadan, try not to strain yourself too much. It's good to be healthy, it's good to exercise, it's not a problem. Swimming is important, and that comes up a lot because of the potential for taking water down and it goes into the throat. Of course, again, you have to then look at the rulings. If you've done it intentionally, then it's quite obvious, isn't it, what's going to happen here? You're going to break your fast, aren't you? Now, if you've accidentally consumed fluid, then I believe that it won't necessarily break your fast. However, there are conditions on that, and you need to speak to your Imam about that, how to deal with it, because I am not 100%, but in general, that's the risk. It's not to say you can't swim. If you can swim, but not swallow any water, good for you, no problem. It's not a problem. It's when you take water in, then you may have issues.
Okay, right, we talked about very common sort of question asked by GP, and you responded very well. So this was Dr. Abdul Mannan talking to us about some of the common question GP have been asked about Ramadan and health issues. Again, as I said, these are the medical responses. If you are concerned about it and if you would like more clarification, please seek advice from your local Imam. They can give you the religious ruling on that. So everything we talked about is from health point of view, and that is the key interesting bit, because the show is all about health. Thank you very much for watching, and thank you very much, Dr. Abdul Mannan, for coming along. Assalamu alaikum.
Wa alaikum assalam wa rahmatullah.